Good morning. My name is Carlos Sanchez. I'm the Public Affairs Director for Hidalgo County. In light of yesterday's announcement by the Center for Disease Control, we felt it appropriate to avail ourselves to the media to answer any questions they may have regarding the coronavirus situation worldwide. I'd like to begin by introducing County Judge Richard Cortez.
Thank you, Carlos, and good morning, everyone. I hope you're enjoying the cool weather. As you know, here in South Texas, it'll soon disappear and you'll have the very hot weather. But we wanted to have this press conference to give you a report as to the status as best as we know what it is, to make sure that any information that was relevant for anyone to have available to take all the precautions necessary for this terrible virus that's going on, that it would be afforded to you through our proper channels. What I want you all to know is that we are in daily contact with both state and federal agencies regarding this matter, and as soon as there any relevant information to be distributed to our people so we can take all the precautions possible will be done as soon as we know about those things. Now, I want you to know that today, and he will give you more details, we can be calm and go back to business as usual because we think that the threat is not here for us. So with that, I would introduce Eddie Olivares, who's the head of our health department here, who will give you all of the details regarding this matter. Eddie?
Thank you, Judge. Good morning, everyone. My name is Eddie Olivares. I'm the Chief Administrative Officer for Hidalgo County Health and Human Services, and I want to go over several things. One, there's a lot of information out there. Yesterday, the Center for Disease Control made some statements in regards to the coronavirus, or what is called Corona 2019, that we're dealing with throughout many parts of the world and throughout Asia. I think the main thing I want to start off with is I want to make this extremely clear. There are no confirmed cases in Texas. None. There's no confirmed cases in northern Mexico. We've been in contact with the Secretaría de Salud in Mexico. We do have 57 cases in the United States. Some of them are located here, but there were travelers. So out of the 57 cases in the United States, 14 were from the cruise ship Diamond Princess that have been relocated, some to Texas, some to California. And we had 17 cases where they were federal employees or U.S. citizens who were relocated here to Texas or California. So in the whole United States, there's 57 cases. None are homegrown, to lack of a better term. The other thing is important to understand. Those 57 cases, many of them are no longer symptomatic. Many of those cases are no longer ill. So they're no longer infectious or ill or any concerns. So over time, once they start healing, the threat is less and less for us. The other thing that's important to look at is only the Center for Disease Control can confirm COVID-19. Your local doctor can't, hospital can't. Only the Center for Disease Control out of Atlanta, Georgia, or Fort Collins, Colorado, can confirm the Corona-19 virus. However, they have to communicate through the local health departments. So if there was any testing being done by a local physician or hospital, they have to be in contact with our department, so we'll be aware of it. So as of today, we have no cases that we're testing through the CDC for coronavirus at all. Remember, there's 7 types of coronavirus. This is very important. I need everyone to hear this carefully, and I need the public to understand this. 4 of the 7 coronaviruses are common colds. So have we had coronavirus in Hidalgo County in the past? Yes, as a common cold, not as MERS, SARS, or COVID-19. The more dangerous COVID illnesses are SARS, the severe acute respiratory syndrome, or MERS, the Middle Eastern respiratory syndrome. Now with COVID-19, it is being looked at because we're not sure where it's going to wind up as far as its development as an illness. So that's why it's very important. But how do you control these illnesses? Hygiene, easiest thing. Cover your mouth when you cough and sneeze. Wash your hands with soap and water. If you do develop a fever, go to the doctor. Get your flu vaccine. Get your flu vaccine to help prevent the flu. People say, well, it doesn't prevent COVID. But it will help us rule out the flu. So if something were to happen in the future and they were to ask you, did you get your flu vaccine? Yes. So that would mean that the chance of you having flu is less. So we're going to start looking at a different area for as far as a virus. It's very important. We're in daily communications with our hospitals, healthcare, and our schools. In fact, we have school representatives here. We have representatives from the state of Texas. Department of Emergency Management for the state of Texas is here as well. We have daily communication with the state and the feds every day. For the last 6 weeks, we've had daily communication. We've been on top of this. Our epidemiological team, under the lead of Dr. Stephen Hinojosa, our lead epidemiologist for Hidalgo County, we've been reviewing this since middle of November, all the way through now. So we've been watching this. So we've been on top of that. There is travel advisories. It's very important to understand that there is travel advisories, and it may impact us here locally. Let me go over those. As of this morning, the level 3 warnings are CDC recommendation that travelers avoid all non-essential travel to the following destinations: China and South Korea. Those are the highest levels. The next level, level 2, these destinations are expressing sustained community transmission of respiratory illness caused by the novel coronavirus. The virus can spread from person to person. Older adults, those with chronic medical conditions, should consider postponing any non-essential travel to Iran, Italy, and Japan. I would encourage everybody to go to the cdc.gov website. These travel information is posted every few hours, so you get the updated version there. Now, what's important to understand also is, and I cannot stress this enough, as of this morning at 6:30, there was 81,200 confirmed cases worldwide. 98% of those are in China, South Korea, Japan, and Hong Kong. So listen to this. 2% or less are in the rest of the world. The majority by far are in China, South Korea, Japan, and Hong Kong. There's a less than 2% death rate for this. So out in the whole world, there's been 2,768 deaths. Out of those, 98% of those have been in China, Hong Kong, South Korea. So again, the threat to us here in the U.S. is very minimal. It's low risk. However, we need to have public awareness of this illness. We need to have it instilled into our public consciousness that we need to be vigilant. We need to be assured and have the confidence that we will be able to deal with this and contain it. However, it takes the public to keep it in line. And I ask everyone, follow the hygiene issues, just like we do with tuberculosis prevention, just like we do with flu prevention. We will be having communication with school districts. We will be having communications with other healthcare partners ongoing to stay on top of this. So it's very important that we look at that. For my part, those are my statements. I think the other thing is, it's important. We have a call center. There is a call center. You could call 383-6221, 383-6221 if you have any questions regarding COVID-19. We have our epidemiological team that's ready to answer some of those questions. You will call that number. Of course, it'll be the health department. You'll get a receptionist and say, I have a question about COVID. They will transfer you to the right person to be able to answer your question. That call center is operational from 8 to 5 p.m. each day, Monday through Friday, and that's available there. But also, you can go to the cdc.gov website, the Texas Department of State Health Services website, to get any updated information. That's all my statement today. Judge Carlos?
Any questions from the meeting?
Is there anything that you're working with or speaking with the airport here in McAllen?
Currently, the only airports that are being looked at, I think we have 7 airports, I think, throughout the nation. There is no direct flights that go to China or South Korea out of McAllen. There's going to be a connection. So Dallas Airport, San Francisco, LA, Newark, Chicago, those are the key. I think Houston, Intercontinental, those are the key airports that had direct flights. But you need to understand, the United States Airlines are no longer flying into China. do not have any flights into China. Some of the Chinese airlines are coming to those major hubs, but they're being assessed and reviewed by the CDC. Other questions?
Well, and in
sorry,
addition
go
to that, I was briefed by the Border Patrol. We always have concerns with the in-between ports, legal ports of entry coming in. I'm going to tell you, you should be very proud of our Border Patrol. They're really on top of it, and they're taking all the precautions necessary to keep those type of people from crossing through illegally through this area also.
What happens in case, let's say, a traveler abroad comes to the area and suspects he's infected? Where would he be tested?
Okay. So here's the way it's going to work. First of all, I need to reinforce what the judge said. We are working very closely with the Department of Homeland Security, Customs Border Patrol. We are talking in communication with public health in Mexico and dealing with their shelters and their centers for some of the immigrant centers. We're in contact with them. So we're always exchanging data and information. In fact, in Mexico, they reported 18 suspected cases. Out of those 18, they all tested negative. So there is no confirmed COVID-19 in Mexico. And in Mexico, they only have one airport, Mexico City, where they fly into. As far as any immigrants coming in, you need to understand the incubation period is 14 days. If a person's been traveling for 14 days and they're not symptomatic, they don't have it. Okay, so that's real important. So to answer your question, there is a criteria that we're working with our medical physicians and hospitals, there's like CDC guidance. If a person, the 3 questions, have you traveled to China or South Korea? Yes or no? Have you been in contact with a person who just, like within the last 48 hours, came from China or South Korea? Yes or no? And are they symptomatic? Yes or no? If the question is no to all three questions, we don't have a problem. If the answer is yes, then they would go to their local physician, review with the local physician. There's guidance that the physician would do. They would get in contact with our epidemiological team at the health department. And then at that point, we would follow the guidance that the state and CDC give us for testing if it is warranted. It may not be warranted. Other question?
So you said there's no reported cases in Texas, but what about the ones in San Antonio?
Well, I thought I explained that. So 57 cases in the United States. We have 40, somewhere in San Antonio from the Diamond Princess cruise ship, and 17 cases that travel. Some of those are in San Antonio as well. So those cases are travelers from China. It did not develop here. They are in an isolated situation under the direction of the CDC, and all reports to us from the state, things are going well, and they're going through, some of them did have the illness, but they will continue to stay there in isolation until they're no longer ill and no longer infectious.
What kind of medication or treatment?
Good question. There is no vaccine for the Wuhan or COVID-19. There is no vaccine. There is active research being done. In fact, UTRGV and the UT system is working very closely to make that happen, but there is no vaccine at this point. But talk to your local physician in those terms. I thought you had a question. Okay, I'm sorry. Okay, other questions? Yes, ma'am.
A lot of parents may be concerned about their kids in school. What kind of communication has been going on with the schools?
We're in constant communication with our school nurses and school district health personnel. We have representatives here today. The main thing here, what I tell all parents, is follow flu prevention precautions. Just like you do with the flu, follow those precautions. Washing hands, using hand sanitizer, covering your mouth when you cough and sneeze. It's very hard for the little ones, I understand that, but it's very important that you stay on top of that, just like you do with flu prevention. Very important.
You mentioned UTRGV is working closely. Do you know who was UTRGV or when?
I know there's some of the research team that's part of UTRGV that's partnered with Texas UT system, the large UT system. I know that there's a collaboration with several of the other UT facilities, and I know there's a couple of researchers here that are doing some research with that. You would need to get in contact with them, but I know that there's a partnership there. Yes, ma'am. So the coronavirus, I mean, the big fear, coronavirus right now is similar to influenza to flu. The death rate on it is, the mortality rate is about 2.3% out of those cases. The majority of them are the elderly or the very young, or people who have co-occurring disorders. They might have other medical complications that cause complications along with the coronavirus. So is it a deadly illness? Not in the terms of comparing it to Ebola or comparing it to SARS or MERS or comparing it to those areas. However, we don't know where this virus is going to go. Again, this is an emerging viral infection that is changing every day. It can mutate to something different. It could mutate itself away and go away, or it could mutate itself and become more lethal. We do not know that. Other questions? All right. Carlos, thank you.
Mr. Olivares has generously offered, if you need any kind of one-on-one interview, he will avail himself in the foyer of this room, and this concludes the press conference. Thank you very much.